Let's turn to China, where the country has reported its first death of COVID-19 patients in nearly 6 months as the country struggles to contain a surge in cases across multiple cities, testing the limits of its tough zero-COVID strategy. Guangzhou has locked down its largest district, while schools across Beijing have moved to online classes. We have more in this report.
Coronavirus began in Wuhan on December 8, 2019. The deadly virus caused death, an economic crash, and humanity had to resort to a global lockdown to curb the spread before vaccines were eventually rolled out. It seems this global catastrophe has become full circle as China looks to battling another epidemic. The country's National Health Commission reported 2 deaths of COVID-19 patients in Beijing following the death of an 87-year-old man in the capital. In Beijing, where authorities reported 962 new infections, students in schools in several districts began studying online after officials called for residents in some of its hardest hit areas to stay home. In Chaoyang, the hardest hit district and home to many international businesses and embassies, the district's government urged residents to stay home over the weekend, with numerous restaurants, gyms, beauty salons and other facilities closed. China's Guangzhou has locked its largest district, while schools across Beijing have moved to online classes as authorities battle numerous COVID-19 flare-ups across the country. Guangzhou, a southern metropolis that is home to almost 19 million people, on Monday announced a 5-day lockdown for most populous districts of Beijing and suspended dining-in services and shut nightclubs and theaters in main business districts. China is the world's last major economy still enforcing strict zero-COVID measures, which aim to stamp out chains of transmission through border restrictions, mass testing, extensive quarantines, and snap lockdowns on neighborhoods or entire cities, sometimes for months on end. Earlier this month, the Chinese government announced limited easing of its zero-COVID policy, discouraging unnecessary mass testing and overzealous classification of restricted high-risk areas. It also scrapped quarantine requirements for secondary close contacts and reduced the time close contacts and international arrivals must spend in quarantine.